The drug industry is trying to put a thumb on the scale to let the U.S. Supreme Court know that other major stakeholders in our healthcare system have a problem with what's going on here, because, of course, it would set a precedent to challenge anything from, drugs used in gender-affirming therapies to COVID vaccines, that those can be challenged even if there's no new evidence, and even if the evidence the challengers are relying upon is weak to non-existent. So I don't know, again, if the U.S. Supreme Court is going to be paying attention to the pharmaceutical industry, but at least you're seeing, I think, the pharmaceutical industry raising the alarm, right, that this is going to be a concern that would have ripple effects across the industry and across the healthcare system, and not just in the abortion context.
So mifepristone is used in conjunction with another pill when you're talking about medicated abortions, and the ruling said that, the FDA didn't go through the testing to make sure it was safe. It's been on the market for 23 years. It has fewer side effects than some other commonly used medications that are out there, like Viagra, for instance. When you take this off the market and you just have the other pill solo, if that's still being offered, what sort of risk are patients in, are women who use that one drug, and if they're trying to get a medicated abortion?
Well, so the misoprostol-only regime, which is what providers are saying they're going to turn to, it's not quite as effective as mifepristone and misoprostol combined. It's still pretty effective, but that means there's going to be a subset of patients who are going to need follow-up care to make sure that an abortion is complete, so they don't have sepsis and other complications resulting from an incomplete abortion. That's one concern. Another concern is that some of the logic of Judge Kaczmarek's opinion would apply to misoprostol too. So I would be not at all surprised to see anti-abortion groups back in court saying, if this is what you mean about the Comstock Act, misoprostol is also illegal potentially, right? So I think we're going to see challenges to other abortion drugs, not just mifepristone, coming down the pike if this ruling is allowed to stand.
And we will see how quickly this ruling or the Fifth Circuit Court of Appeals weighs in. We will see how quickly the Supreme Court potentially decides to weigh in on this, how quickly it gets a motion to go to the Supreme Court, and what happens then. It seems like we have a lot coming when it comes to this conversation. Yeah, I know, it's an understatement. Mary Ziegler, Mary, thank you very much for coming on the show and helping us understand what's going on here. We appreciate it. And that is going to do it for me today on a